Hi, I'm Matt Willis, Public Health Officer with today's COVID-19 update. Today I want to talk to you about the rise in cases in Marin over the past 2 weeks. More Marin residents have been diagnosed with COVID-19 in the past week than in any prior week. We've also more than doubled our testing capacity. The increase in cases is partly due to increased testing, which makes sense. But what we want to know most when we see spikes in cases is whether or not we're actually seeing an outbreak, something new, or if it's just because we're testing more people. We have two ways to know the difference between those two things. One is the percent of tests that are positive. Our percent positive rate rose from 4.4 to 5.3% over the past few days. This means that even while we're testing more people, a greater proportion of those tested are infected. This suggests we're likely seeing at least a slight rise in actual virus transmission. Another thing we look at is hospitalization rates, and this is probably the most important indicator of the actual burden of COVID-19 in our community. A certain fraction of people who become infected become sick enough to be hospitalized, whether or not they've been tested. And those we generally don't miss, because we only have 3 hospitals with daily reporting from each of them, and everyone admitted to the hospital with COVID symptoms is tested. But hospitalizations is a lagging indicator. Any spike in hospitalizations would follow a few days after a spike in positive rates, because severe illness generally develops days after diagnosis. So this is something we're watching very closely every day. It's reassuring to see that our numbers of people in the hospital have not increased over the past 2 weeks. The increased testing is offering us an important insight into who's getting infected and where in our community. This has key implications for our shelter-in-place lifting. Starting May 4th, we're now collecting the work history of everyone tested and finding that most people who test positive have been out in the workforce during the shelter-in-place, working in grocery stores, in long-term care facilities, hospitals, construction, landscaping, and other public-facing jobs. People have been working outside the home, interacting with one another at the workplace and with the community, are being exposed and infected. This is important to think about as we reopen, to even more of us joining the everyday workforce. We need to work from home as much as possible and take all the precautions to protect ourselves by covering our face, maintaining physical distancing of at least 6 feet, washing our hands, and not going to work or school or camp if we're feeling sick. We're also launching a campaign to get our workers, regardless of their employer, countywide, to seek testing at one of our free testing sites up to monthly. You can read more about this initiative in our daily update today. Thank you for remembering that we are still under the shelter-in-place as we slowly rebuild. And thank you for doing your part to keep us all healthy.